Good afternoon to all. Am I audible?
Yeah, I am. Oh, yes, ma'am. You're audible.
Okay.
Yeah, I am. Oh, yes, ma'am. You're audible. Good afternoon, ma'am.
Good afternoon, ma'am.
Good afternoon.
Good afternoon, ma'am. How are you, ma'am?
Yeah, fine. Thank you.
Good afternoon.
Good afternoon.
Marina ma'am, we will start or we'll wait for 5 minutes?
Uh, you can start on time. Has principal joined? Main people have joined. I think you can start after 2:05. We can start. I think.
Yeah, ma'am will be joining.
Okay.
Ma'am will be joining. Yeah, ma'am. Now we can start.
Okay.
Aishwarya,
Yes, ma'am.
you can start. Aishwarya.
Yes, ma'am. A warm good afternoon to one and all present here. I feel privileged to welcome the August gathering on behalf of Department of Clinical Nutrition, Madras Medical Mission College of Health Sciences in association with IDPL. I request the participants to switch on your videos and kindly mute yourself. Microbiome and its role in health and disease is a rapidly growing research focus for biotech, academic institutions, and pharmaceutical companies. Many research areas from immunology to oncology to metabolic diseases are being impacted by the commensal microbes of the host. So, today's webinar topic is all about an insight of microbiome in gut health and disease management. Prayer is a man's greatest part, and it becomes more meaningful when we pray for others. I request Ms. Leona Kripa to commence the program with a prayer song.
Praise the Lord. You are my strength when I am weak. You are the treasure that I seek. You are my all in all. Seeking you as a precious jewel, Lord, to give up, I'd be a fool. You are my all in all. Jesus, Lamb of God, worthy is your name. Jesus, Taking my sin, my cross, my shame, rising again, I bless your name. You are my all in all. When I fall down, you pick me up. When I am dry, you fill my cup. You are my all in all. Jesus, Lamb of God, worthy is your name. Jesus, Lamb of God, worthy is your name.
Thank you, Leona. I would now request Ms. Marina Elizabeth Alex Ma'am, Assistant Manager Dietetics, Madras Medical Mission, Chennai, to present the welcome address and also to introduce our speaker for the day.
Just share my slide. Just hold a second. Can all of you see the slide?
Yes, yes.
Yes, ma'am.
Yes, ma'am.
Okay, it is my pleasant task to welcome one and all to this nutrition education program. I would like to welcome Dr. Deepa Philip, Principal of College of Health Science. She has been very supportive in conducting this education program. I also welcome Lali Luke and Eunice. They were the people behind this program. Thank you for all the coordination. Welcome all the faculties of College of Health Science. Welcome all the students. Welcome the member. I welcome the members of IAP in Indian Association. All the members, I welcome them. I welcome also Harsh Doshi from Hug Beverage. So he will be sharing his knowledge about the product that he is involved in. So he will share his experience. So coming to IAPN is actually established to enhance the quality of nutrition management among healthcare institutions and to conduct research in the field of clinical nutrition, deriving a consensus statement on nutrition care and quality control. So nutrition management, especially when you see the enteral and parental nutrition, it has to be effectively coordinated between the doctors, nurses, and dietitian. So this is an association exclusively for a nutrition support team, for which we can do a good quality nutrition management for the patients. So this association, IAPN India, is being headed by President Dr. Ashwin Dabi, and Vice President of Medical Unit is Dr. PC Vijay Kumar, and from Nutrition Head is Mr. T. Shiv Shankar, Secretary is Ms. Lekha, and Treasurer Data Patel. So we are having also a member of Executive Council, Dr. Biju, Dr. Mansi, Ms. Anshu, Srimati from Bangalore, Sangamitra, Dr. Shilpa, Ritika, and Ms. Priya. So these are the people who are newly elected from the Chennai chapter. So welcome one and all to this nutrition education program. Welcome Dr. Bhuneshwari, Dr. Vanmati, myself, I'm the secretary, and treasurer, Ms. Rajeshwari, and executive committee members are Dr. Lata and Ms. Vijay Shri from MGM. Welcome all the members. So these are all the contact mail IDs. So for people who wish to become a member of IAPN, you can very well welcome and contact us. So it is very essential to form a team, especially inside a hospital, so that within a doctors and nurses as well as dietitian. So this will be a forum to share nutrition knowledge between the specialties, like interdisciplinary knowledge. We will be able to better coordinate things. So coming to the topic that we are going to see is an insight on microbiome in gut health and disease management. So all of you are aware that 100 trillion bacteria are there in our gut, and they have a very vital role to play. And so we have a very eminent guest with us, guest speaker, Ms. Uma Shankari. She is assistant dietitian in Jipmer, Pondicherry. She's a registered dietitian with more than 15 years of clinical expertise and handling multi-specialty nutrition management, and excellent diet counselor, and much experience in planning the enteral and parental nutrition. She has done her post-graduation in food service management and dietetics from Indira Gandhi National Open University, New Delhi, and she has done a diploma in dietetics from CMC Vellore. She has completed a certificate course of nutrition and child care from Indira Gandhi National Open University. She has also completed her LLL module with renal disease, cancer, GI disorder, and critical illness. She has conducted a lot of nutrition awareness program among the corporate companies like Ashok Leyland, Chettinad Public School, and Rotary Club. She has won many prizes, and she has presented lecture in various national conference, organized many seminars and national conferences. She's a national executive member of Indian Dietetic Association Puducherry chapter, as well as she's a regional officer for IAPN Puducherry chapter. She has also well experienced in conducting researches. So ongoing projects are going on evaluation of micronutrient deficiency and bone health in South Indian patients undergoing bariatric surgery, prospective observational study. And I welcome you, ma'am. I thank you for accepting our invitation and participating for this program and sharing your knowledge on the microbiome, ma'am. I welcome you, ma'am.
Thank you. Thank you for the introduction, ma'am.
Yes, I'll just stop share.
Well, I thank Marina Alex ma'am for giving me this opportunity, and I thank the organizing committee and IAPN Chennai chapter for this opportunity. Each time when we share our knowledge keeps developing. That's what I feel. So this time also, I have learned a lot before presenting the talk. Thank you, ma'am. Shall I start sharing the screen?
Sure.
Yes, ma'am.
Can you see my screen, ma'am?
Yes, ma'am. You can put slideshow, ma'am.
So today's topic is insight on microbiome in the gut health and disease management. Before going into the topic, let us first know about the human microbiota. These are the topics we are going to deal. What does the gut microbiome do and how it benefits our body? What happens if the microbiome is altered, and gut microbiome disease management? So we are human beings as a whole. There are around more than 100 trillion symbiotic microorganisms live on and within the human being. So these microorganisms which is in human body is more than the number of cells in the human. So it is, and the genes, approximately 150 times more genes than are found in the entire human genome, and it constitutes about 2 kg of the body weight. And it is very important that these microorganisms on the whole includes bacteria, virus, fungi, but bacteria are the most important in this human microbiome, and they have many metabolic functions in the human body. And so far, it has been performing so many metabolic processes, modulating immune system in human, and it also produces many metabolic metabolites in the human body. So hence it is known as hidden metabolic organ. See, these microorganisms are found everywhere. Not only in the gut, it is found throughout the body, in the skin, nose, mouth, wherever our body comes in contact with the external environment. Wherever there is an opening in the body. So everywhere you can see these microorganisms, urinary tract, rectum, vagina, everywhere. And you can see the more number of microorganisms, this microbiome is found mainly in the gut gastrointestinal tract. The microbiota can be viewed as a metabolic organ because it performs more physiological functions in our body. So what are the factors which affect the human microbiome? Human microbiome is affected by different factors starting from there are many factors which influence the composition and functions of these microbiota. As we have seen that there are microbiome throughout the body, but the gut microbiota plays a major role in the human microbiome. And many factors which influence the composition of this gut microbiota, starting from the mode of birth. So it has been studied that the mode of birth, either it is vaginal delivery or a C-section, decides the gut microbiome of a newborn baby. As a baby is born, the gut is found to be sterile, but the mode of birth decides the gut microbiome. Next, feeding, what type of feeding the baby is taking, whether it is breastfeeding or artificial feeding, that also determines the microbiome of that particular newborn baby. And after that, various other factors like diet, environment in which we live, and the medicines which we take, all these processes decide the gut microbiota. This, as soon as the baby is born, till 2 years of age, there is a change in the alteration in the colonization of these microorganisms. By 2 years, it is almost like an adult microbiome, and from there onward, it's starting a that decides the adult microbiome of that individual. Later on, these microbiome may change according to the environment in which they live and which they are exposed to. So what does this gut microbiota do? So we have seen that most of the microbiome which is in gut is, we have all this bacteria, especially we have anaerobic bacteria which resides in the colon of the gut. The colon of the gut accommodates more microbiome when compared to the small intestine, and this colon is having an anaerobic atmosphere. There is low level of oxygen, and it facilitates the presence of these anaerobic bacteria, and these anaerobic bacteria are very helpful to human beings. So what exactly the gut microbiome do to human body? So this gut microbiome first acts as a physical barrier. So it lines inside the lumen. It forms a physical barrier between the toxic antigens, other toxins, and the outside body. And what happens? These healthy, good bacteria, which are helpful for human beings, also prevent the growth of other harmful bacteria inside the lumen. They produce short-chain fatty acids such as acetic acid, propanoic acid, and butyric acids. These acids, these short-chain fatty acids, serve as an energy source to the host intestinal epithelium, and this butyric acid and all this short-chain fatty acids are a main fuel for this colonocytes. It helps in the cell differentiation and proliferation of the colonocytes. Thus, it maintains the healthy gut. Helps in maintaining a healthy gut. It also helps in the synthesis of vital nutrients such as folate, vitamin K, biotin, riboflavin, cobalamin, etc. These gut microbiome also helps in the absorption of ions including magnesium, calcium, and iron. They stimulate normal development of humoral and cellular mucosal immune system. These gut microbiome plays a major role in the development of a proper immune system, defense system in the human body. So it is said that heal your gut and you heal yourself. So when the gut is not functioning properly, I mean, when the gut microbiome is altered, it may lead to many metabolic syndromes, and also it leads to other infections. As we have seen, the gut microbiome ferments the short-chain fatty acid in the colon, and it produces acetic acid, propanoic acid, butyric acid. These are used by the enterocytes and other cells and helps in mineral absorption. Randomized controlled trials have shown that higher production of short-chain fatty acid is correlated with the lower diet-induced obesity. Now we can see like how nutrient intake, how the nutrition of a particular individual affects the gut microbiome. As already we have seen, it acts as a selective barrier, and it allows only nutrient and water to enter the body while preventing the entry of toxins and antigens. But when the gut is inflamed or distressed, our defense system gets damaged. That is, the mucosal layer gets damaged, and it allows the toxins to enter the body. A healthy diet can preserve gut microbiome. Eating a diet with adequate fiber may play a significant role in gut health. These are non-starch polysaccharides, which is not digested in the small intestine, later enters the colon where it is fermented by these microbiomes, and this microbiome is this microbiome ferment this fiber into a short-chain fatty acids. These short-chain fatty acids helps in pH balance, promoting optimal environment for beneficial bacteria. So the diet plays a major role in the colonization of a beneficial bacteria. A diet which is high in fat and low in fiber is tend to cause altered microbiome, which may lead to metabolic disorders in human body. And it also found in few studies that few of the food additives which we use in processed foods, such as emulsifiers, sugar substitutes, these are found to alter the gut microbiome. Thus, a healthy diet will increase the number of beneficial bacteria and maintain the gut microbiota, helps in the proper functioning of the immune system, gut immune system, okay, gut modulated immune system. So this is a representation. What exactly happens? What is the exact role of gut microbiota in health and disease? Giving some examples of inputs and outputs. As we can see here, these are the output. whenever there is a we give dietary food intake, everything. So there is a production of certain fatty acids, antioxidants, improved lipid metabolism, loss of gut inflammation, insulin sensitivity is being maintained by this gut microbiota, thereby preventing insulin resistance. Reduced risk of some infection. When in case of any disorder or in case of any altered metabolism, altered microbiota, it may lead to other metabolic syndromes like obesity, diabetes, increased cardiovascular disease, gut inflammation, cognitive decline, etc. Even it has an effect on neural system also. Okay. As today we are being using different antibiotics, different medicines, drugs for treating various diseases. All these drugs, whichever we are using for treating the infectious diseases, like HIV, hepatitis, or any antibiotics, broad spectrum antibiotic mainly, are found to damage these gut microbiome, and there is a shift in the good bacteria and there is increase in the pathogenic bacteria. So what happens? Ultimately, it leads to the microbial dysbiosis, and it leads to Clostridium infection, antibiotic resistance, there is a immunocompromise, and finally it leads to multi-organ dysfunction also. So what is gut dysbiosis? As we were talking, there is a change in the colonization, that is human gut microbiome consists mostly of anaerobic bacteria, especially like bacteriocytes. These bacteria, which are called as good bacteria, when there is an imbalance in this bacteria, that means this good bacteria has been reduced and bad bacteria, especially, which causes inflammations, diseases like, as we say, increased amount of gram-negative bacteria leads to gut dysbiosis. Okay. So many bacteria in your gut are actually good bacteria, meaning that they will not cause you any harm. The rest of the bacteria are called as opportunistic bacteria. They will reside in the gut, but to a minimum number, a lower number, so that it won't harm anyone. But when there is a dysbiosis, this number exceeds the number of good bacteria, thereby causing a gut dysbiosis. What happens when there is a gut dysbiosis? As we have seen, there is altered gut microbiome. So these healthy gut, as a intestinal epithelium is a single layered epithelium, and it being covered with a mucus layer. This epithelium has got normal tight junctions in a healthy individual, and this tight junction is being maintained, and it helps in the permeability. That it means it won't allow any toxins or antigens to enter into the bloodstream. In case there is a dysbiosis, what happens? There is a damage in the tight junction. That means the epithelial cells, in between the epithelial cells, there is a small gap is formed, through which, that is, the intestinal permeability is increased. Thereby, all these toxins or the metabolites of the harmful bacteria, the toxins and metabolites produced by the harmful bacteria, enters the bloodstream. So here you can see mainly the polysaccharides. Okay, this is and other toxins. Mainly this lipopolysaccharides and is also known as endotoxin. Okay, when these endotoxins enter the bloodstream, it is known as endotoxemia. The passage of lipopolysaccharides and other pathogens into bloodstream causes the activation of immune system and leads to a low-grade inflammation. When there is and this is called as endotoxemia. This endotoxemia, that is the accumulation of these endotoxins in the bloodstream. Many studies have investigated the intestinal bacteria as a major source of lipopolysaccharides. In a normal condition, these intestinal it won't allow this lipopolysaccharides to escape into the bloodstream. But in case of a dysbiosis, the gut becomes a leaky gut. That is called as a leaky gut syndrome, where this lipopolysaccharides ultimately reaches the bloodstream. Okay, that is a translocation of bacteria and other toxins. This lipopolysaccharide tend to increase cytokinins and other immune modulators, thereby causing a low-grade inflammation. When there is a long-term low-grade inflammation, is associated with the increased risk of cardiovascular disease, type 2 diabetes, and other metabolic syndromes. And it may lead to multi-organ failure also. Okay. Metabolic and inflammatory disorders including obesity, non-alcoholic steatohepatitis, hepatitis, inflammatory bowel disease are linked to a defect in the tight junction barrier. So in order to maintain a gut health, this gut microbiome plays a major role, and altered microbiome will cause a defect in this tight junction barrier of the intestinal epithelium. Therefore, maintaining the tight junction integrity is a possible strategy to treat these diseases. High fat diet induced metabolic disorders are associated with gut dysbiosis in both animal and human. So gut microbiome and what all the changes or the disease conditions caused by this gut microbiome, altered gut microbiome. The microbiome is implicated in variety of disorders. Much recent research has found evidence for a role for the microbiome in many diseases including skin, metabolic, cardiovascular disease, as well as cancer, infection, and neurodegenerative and psychiatric disorder also. So these dysbiosis or altered gut microbiome is found to affect many, cause many disorders, even neurodegenerative disorders and some autoimmune disorders. It also leads to many GI disorders like inflammatory bowel disease, ulcerative colitis, etc. What exactly happens when there is a gut dysbiosis? As we have seen earlier, this tight junction is being impaired. And you can see this bacteriotids, proteobacteria, these are good bacteria which are found in a larger number in a healthy gut. But when there is a dysbiosis, these bacteria are reduced in number, and you have more of gram-negative and firmicutes in the gut. Thereby, what happens in a impaired gut microbiome? There is an increase in lipopolysaccharides. There is decrease in tight junction integrity, and there is a reduced energy hormone. This short chain fatty acid production plays a major role in energy harvest inside the gut. Okay. They regulate the energy consumption of a human being, and it also decides, it also affects the appetite signaling in a human. So they play a major role in appetite signaling. And these acetate, especially acetate and also propionate, what they do is they play a major role in appetite management, signaling, and lipogenesis, and maintaining the cholesterol level. So when there is even in a normal human being, in a normal gut microbiome, balanced gut microbiome, there is increased insulin sensitivity, adaptive immunity, inflammation, reduced inflammation, and reduced cardiovascular risk. But opposite to that, dysbiotic microbiome, there is an increased resistance, which leads to obesity, and further which leads to type 2 diabetes. There is an increased low density lipoprotein triglycerides. There is increased adiposity, increased insulin resistance. What happens exactly? This all factors leads to various metabolic syndromes. Even this lipogenesis or adiposity causes liver disorders, and increase in this lipopolysaccharide leads to cardiovascular disorder. So microbial dysbiosis and CVD. What happens when there is a gut dysbiosis? The trimethylamine or N oxide, that is trimethylamine, which is produced by this gut microbiome will enter the liver, and there it is converted to trimethylamine N oxide. This trimethylamine N oxide is positively associated with the cardiovascular disorder and leads to MI or heart failure. So major cause of cardiovascular disease is this trimethylamine, which is formed in the lumen, and in a normal condition it won't cross the intestinal barrier, but in case of a gut dysbiosis it is allowed to cross the epithelium and reaches the blood circulation, thereby increases the atherosclerosis, and there is a increased formation of thrombosis, which leads to cardiovascular disease. Gut microbiome and critically ill. See, as we are talking about various other diseases, conditions, this gut microbiome plays a major role in a critically ill person. This dysbiosis can occur within hours of surgery or onset of critical illness, even without administration of antibiotics. That is, it won't take much time to cause a dysbiosis. This dysbiosis causes immediately, within a very less time span, in a critically ill or immediately after any metabolic insult. These pathological changes in microbiota may contribute to important clinical outcomes, including surgical infection, bowel and stomach leaks, acute kidney injury, respiratory failure, and brain injury. See, as I had told you, like for this gut microbiota damages the intestinal barrier and allows all toxins to the bloodstream. During this process, a lot amount of uremic metabolites are being increased. The amount of uremic metabolites increase in the blood, and it also damages the kidney, leading to chronic kidney disease. And this gut also causes multi-organ failure. So early EN within 24 hours of admission to ICU has been advocated in medical and surgical patients to avoid derangements of the intestinal epithelium, thereby avoiding the bacterial translocation, which may lead to septic shock. A specific reason for providing the EN is to maintain the gut integrity. So whenever there is a impaired gut integrity, we always advise to start EN, even with the patient who are not tolerating feeds. It is advised to start with the trophic feeds, and most of the cases where there is a reduced gut integrity, they tolerate these trophic feeds. See, gut microbiome in various GI and liver disorders. This gut microbiome causes transports these hepatotoxics and also leads to the accumulation of fat, that is steatosis in the liver, which further leads to non-alcoholic fatty liver that may lead to cirrhosis. Sometimes it may cause hepatic cellular carcinoma, HCC. So thus the bacterial dysbiosis can drive hepatitis and cause inflammation in the liver, leading to various liver disorders. Mainly this GI disorders like IBD, ulcerative colitis are found to cause by this gut dysbiosis. Targeting the microbiota remains attractive options in treating the disease cause. So now they have come out with various options where they are trying to restore the gut microbiome. When there is a dysbiosis, treatments are provided. These treatments are aimed to restore the gut microbiome, thereby reducing the disease symptoms. Colorectal cancer. The pathogens such as Fusobacterium, Nucleatium are overexposed in adenomas and cancers of the colon. See, mainly when there is a reduction in the butyric acid producing bacteria. Okay, when there is a reduction in butyric acid production, that is short chain fatty acid, especially butyric acid, which is a major fuel for the colonocytes and which maintains the gut integrity and the gut cell, which helps in the proliferation of colonocytes. When there is a reduction in this short chain fatty acid production, this may lead to colorectal cancer. Okay, when there is a reduction in the short chain fatty acids, because this short chain fatty acids are found to reduce the cancer producing toxins. They protect the colonocytes against the cancer producing organisms or toxins. Thus they maintain the gut health. When there is a low production of short chain fatty acid, it may lead to colorectal cancers. And it is also found that there is high when there is a high number of Helicobacter pylori leads to gastric cancer. There is some altered gut microbiome related with breast cancer, lung cancer. The studies are being still on process. So now they have started doing different. They have started with different treatment modalities. Like they have come out with giving probiotic and prebiotic supplementation or symbiotic supplementations for various disease management. And this is being used mainly in various disorders, and many studies have proved that use of probiotics in case of diarrhea associated with antibiotic usage, mainly in pediatrics, has shown a better results. Okay, when we are providing, especially this lactobacillus, along with the antibiotic, it helps to improve the antibiotic associated diarrhea in pediatric condition. And there are studies which have shown that probiotic supplementation in case of HIV or AIDS patient found to improve the associated diarrheal symptoms. And it also improves the CD4 count in HIV or AIDS patients. And probiotic, still probiotics or prebiotic treatments as being used in various other disease treatment, but still there is no concluded, or we are not yet come to a conclusion how it is works and how far it is safe. And this is a fecal microbiota transplantation. This is being used, but this is not something new. It has been used since 4th century. And in 1958, they have come out with this sort of treatment, and it's being used in many disease symptoms, especially in case of treating diarrhea. Now, many research studies are being done on this fecal microbiota transplantation. It's especially how it is done. A healthy donor, a healthy person's fecal is being diluted, strained, and that being injected into a patient with a gut dysbiosis. Okay, so thereby the patient is directly injected with a healthy microbiome from a healthy person, which restores the gut microbiota. That's being done in various disease conditions. Most of the time, diseases, some of the diseases shows a positive result, and few it is not at unformed. So what are the studies has been done is Clostridium difficile infection, irritable bowel syndrome, inflammatory bowel disease, obesity, various autoimmune diseases, and myasthenia gravis, where these fecal microbiota transplant is being studied, but not yet fully proved or fully have found the proper result. While it's a promising therapy for many patients, fecal microbiota transplant is a challenge for the donor. Okay, because we have to get a healthy donor. Sometimes we don't know exactly what microbiota will be helpful in restoring the microbiota in that particular patient. Summary: gut microbiota influences many areas of human health, from innate immunity to appetite and energy metabolism. Targeting the gut microbiome with probiotics or dietary fiber benefits human health and could potentially reduce obesity. Drugs, food ingredients, antibiotics, and pesticides could all have adverse effect on the gut microbiota. Microbiota should be considered a key aspect in nutrition. The medical community should adopt their education and public health messages. Fiber consumption is associated with the beneficial effects. Thank you. Thank you for your patient listening. And once again, I thank the organizing members, Marina ma'am, and IAPN Chennai chapter for giving me this opportunity. Thank you very much.
Thank you, ma'am, for sharing such a valuable information with us. I would like to request the participants to drop your questions in the chat box.
I think meanwhile, the Harsh Doshi also has to present. You can just ask whether he's ready to. No, we can discuss.
Good afternoon, Marina ma'am. More than ready to start presenting, but I'm happy to work as per your schedule.
Yeah.
Yes, ma'am, I'll give a small intro. I request Mr. Harsh Doshi, founder of Herb Beverage, Rebuilding Gut Health Using Traditional Indian Food, to share a few words. Sir, you're on mute.
Sorry, can you hear me now?
Yes, sir.
Much better. Thank you so much. This is a really wonderful session, and I appreciate being invited by Marina ma'am and the team as well. Also, a very informative session by Uma ma'am. I think the detailing of our current understanding of the gut microbiome has been laid out extremely well. I'll give you a little bit of my background, and I'll tell you how I would like to add to this particular topic. We are setting out to build a gut health company, and we're doing some pioneering work in the field of traditional Indian fermented food and gut health in particular. Now, for us, when we started out, there's no question that gut health is important, but we needed to understand, how do you improve gut health? So I'm going to just rewind the clocks about half a decade ago, 5 years back, and sort of walk you through what our procedure was. I'm going to reveal two things. I'm going to talk to you about our framework of understanding gut health. We've come to realize after almost 5 years that gut microbiome is one part of gut health, very important, but there are some other aspects that need to be maintained to take a gut from a state where there is any type of dysbiosis to a state where there is complete balance and complete health. I'm also going to be talking about our approach, right? So what type of food we typically want to introduce to be able to make some of those changes. I'm just going to share my screen, and maybe you can tell me if you can see it. I hope this is visible.
Yes, sir.
Yes, sir.
All right, wonderful. So like I said, a little bit back first, I'm going to take you to, most importantly, rather, where we started. So to understand gut health, we went to the most obvious place, which for us was colonoscopies. We wanted to take a look at almost 100 colonoscopies to understand what's exactly happening inside. And one of the most unique patterns we noticed throughout these colonoscopies, in almost 60 to 70% of them, we kept seeing the recurrence of worms, and in particular tapeworms, again and again. Now, as is the advice of a typical gastroenterologist, a deworming pill would often get the worm removed from the colon, right? So the actual germ would be eradicated altogether. But unfortunately, every 15 or 20 days, when you do a colonoscopy one more time, you would see that that worm would come back. Interesting, right? You've removed the worm eggs. There are a lot of larvicidal and ovicidal compounds in a typical deworming pill, but the worm still seems to come back. And eventually, after studying those reports and a number of experiments, we came to realize that this is the point where almost everybody focuses, right? Which is on removing the worm as an attempt to create better gut health, when the actual methodology and procedure needs to be in clearing the terrain so that a worm or any such pathogenic strain, even if it does enter the system, can be removed on its own. And I think that was the first and most important distinction that we had a chance to make, which is don't focus on the worm, focus on the terrain. And this sort of philosophy is what we've implemented and applied throughout our studies across the 5 years. Now, when I'm referring to a worm, I'm not talking just about the worm. The same concept extends almost to anything you want to talk about. Don't focus on a particular strain of bacteria. Focus on the terrain so that it can harbor the right balance of both good and a small portion of bad bacteria. It applies to fungus like Candida. It applies to different types of other pathogens, right? Like E. coli, for example. One of the areas we took a lot of inspiration from was the Institute of Functional Medicine. There are today over 3,000 IFM practitioners that start by focusing on the gut. And interestingly, all of them use the same 5-step framework that we have also come to adopt. That framework goes remove, replace, re-inoculate, repair, and rebalance. And if there's really one message that I can communicate through this occasion today, it is a focus on this framework to take a client, a patient, or even yourself from a state of dysbiosis to a state of far more improved gut health. Now, it goes without saying, do not self-medicate. This information is purely informative. You must be working with a certified health professional to move through these stages. My aim is to give you a categorical understanding of how to move from step 1 to step 5. I'm going to start first with the remove phase, right? What is it that we're trying to remove? It is almost impossible to create a building if somebody is constantly breaking it down. For us, the 3 largest factors which contribute to any type of gut breakdown in the first place are stress, irritants, and pathogens. Stress is pretty self-explanatory. Irritants typically happen from an allergy standpoint, right? So you've got food intolerances, something your gut is not sensitive to. There is also a genetic component. Some colons in particular have a lot more nerve density than other colons, and that creates something which is far more sensitive than the average person's colon. And so that's the irritant piece. The pathogen piece is something that we see a very alarming rise in rates of today. Worms, pathogenic strains, candida infections. Unless these are addressed first, it is very difficult to take the next step. Said differently, just consuming a probiotic or prebiotic is not adequate to bring your gut into a healthy state, or in fact, a matter in a state where it is not imbalanced, unless you start with a removal phase. Now, removal depends, as you can imagine, on how chronic the condition is. But we typically see that it takes anywhere between 2 to 3 weeks. And I'll walk you through some of the things that can be done. Most practitioners today will use an elimination diet. And there's a lot of trial and error to figure out, especially from an irritant standpoint, what foods you are tolerant or intolerant to. And that's sort of the starting point for something which is part of the remove plan. The second one is replace. I find replace to be, I think, in my opinion, one of the single most effective measures to take gut health back to normal. When I talk about replace, we talk about 3 things in particular, right? Stomach acid, enzymes, and flow. I've kept the presentation non-technical because the time is short. So I want to go through some of the key concepts. Stomach acid, I think, is one of the most overlooked aspects of gut health altogether. Low levels of stomach acid or stomach acid with an imbalanced pH, right, where the stomach acid is more alkaline than it needs to be, is is now treated, so in fact is now known as the root cause of several ailments that affect the system through and through. Low stomach acid affects acidity and refluxes, heartburn. Low stomach acid affects absorption of nutrients, in particular like iron and B12, because there is less intrinsic factor being released. Low stomach acid also affects gut motor transmittability, right? So your actual migrating motor complex, the process by which the gut cleans itself, is also drastically affected. When we talk about replace, we want to bring these three into the right place, right? For something like digestive enzymes, on a common day-to-day technique, smaller things like spices in food typically help with the release of several digestive enzymes like trypsin, amylase, etc. For bile flow, it really depends, right? Your focus needs to be on the gallbladder, but also the liver. And a liver cleanse, right? And I don't mean this from a superfood or a supplement standpoint, but rather from a preventative standpoint, typically helps promote, is very biliary in nature, right? So helps promote normal bile flow. The third one is the one that we just spoke about extensively, and I don't think I can do a better job than Uma ma'am just did. Reinoculate, right? We need to be able to flush the bacteria with the right, flush the gut, with the right type of bacteria. And when we talk about the right type of bacteria, I think this is a very important distinction to be made. On average, in your gut today, if you have not taken an antibiotic pill, there are more than 500 different strains of bacteria, and this is at minimum. I'm talking after you do a shotgun sequencing on a genomic level. Repopulating that bacteria with one or two strains, and in India today, there are only 7 commercially available strains, which are probiotics. You'll have your plantarum, you'll have some acidophilus strains. So using 7 strains to repopulate a gut, which should otherwise have at least 500 different types of bacteria, is not the only approach. There has to be a wonderful mix of fermented food, of prebiotics, and of probiotics to be able to create tremendous bacterial diversity that can take care in and of itself. Typically, reinoculation for patients after an antibiotic course can take as little as 6 weeks and as much as 6 months. So it really depends on the state that you've brought your gut to after the remove and replace phase. The third one is one that I'm so happy was mentioned in the presentation before, which is repair. Short chain fatty acids in particular have been known to restore the integrity of the gut wall. This is not just one layer, it is one cell thin, which keeps toxins out and keeps or allows for absorption of the right type of minerals and nutrients through the wall into the body. A leaky gut essentially looks like a building with a broken wall, right? You have sort of holes in the gut, in essence, that allow the wrong type of nutrients or toxins to enter the system in the first place. That's the place we're focusing on. A lot of gut practitioners have narrowed it down to a couple of amino acids, right? So, and a couple of proteins as well, glutathione, glutamine, typically available in bone broth, omega-3s that help restore the gut wall. But trying to focus on just these nutrients is, again, the wrong way to take things forward. The approach has to be holistic if you want to be able to start rebuilding your gut wall integrity. The last piece is one that I think nutritionists today absolutely excel in, right? Which is rebalance. You cannot maintain a good gut after you've gone through the first 4 steps if you're not building the right type of habits for a lifestyle, right? Whether that's movement, like exercise, the right amount of sunlight, adequate hydration, any of these steps that are not done in congruence with the first 4 hours of the framework do not lead to long-term sustainable changes. And so I'll quickly run you back to the summary slide, right? Which is you've got remove, replace, reinoculate, repair, rebalance. This isn't a framework that we've come across. This is a framework that has today been used by 3,000 gut care practitioners after 15 years of trial and error that shows actual clinical results in patients with severe dysbiosis. I want to move and talk, as my last part of the presentation, about some of the current therapies and why they fall short. Today, there is no dearth of juice cleanses that are flooding the market, right? You'll have a green juice cleanse and an orange juice cleanse and etc. But if you look at a juice cleanse from this particular framework, you'll notice that it only does one thing. If at most, the only thing that it will do is probably help you remove. A juice cleanse doesn't typically move throughout the phase, which is why juice cleanse is like a part detox, right? It helps you only in stage 1. Think about something like a probiotic supplement, right? Maybe a Japanese drink with milk and sugar that you have in the morning. That again only helps you with one part of gut replacement. So overly relying on any one product or one offering or a good marketing spin by any company is not adequate to take you from where you are to where you need to be. And when I say that, I mean this impacts almost every problem. Your constipation, your hyperacidity, your gas, your bloating, all of this is interlinked. And relying on a single product to try to fix it is exactly like relying on medicine to do the same. Apple cider vinegar, right? I thought this was important to mention because it's become such a big buzzword today. Apple cider vinegar at best does 2 out of 4, 2 out of 5. Having this supplement in the morning is inadequate to take things forward. And as a parting note, I'm just going to quickly talk about our work. What we've tried to do is we've tried to be the first step that uses traditional Indian fermented food to tick all of these boxes so that it makes it easier for you to start on your gut restoration journey. We call ourselves Hug. It comes in the format of a small 100 ml drink, something you can have in the morning. And the reason we call ourselves Hug is if you give your body a hug, you may never need a drug, right? That's sort of the longer term thinking that we typically have. It's why we use real wholesome food. No extracts, no sugar. Those irritate the gut lining. And we want to stay away from something like that. I'll quickly run you through some of the results we've got. From the remove phase, this is what we see with worms. Within 5 days, you see hatching of worms becoming 90% shorter. Across this phase, from a bile flow standpoint, an enzyme standpoint, or a stomach pH standpoint, you see noticeable improvements. This is your gut diversity before. We actually spent a considerable amount of money doing a shotgun sequencing test. This is what your diversity would look like before. And this is what your diversity would look like after. You can see a pretty large increase in proteobacteria. And my personal favorite, which is your actual diversity, right? On the Simpson diversity test, you see a meaningful difference after taking the right type of ingredients. And the last one is short chain fatty acids. In particular, butyric acid is the one that the product focuses more on. The link between SCFAs and gut wall restoration is now it's not under question anymore. And to be able to see beverages made with real food that can help you get there really, really contributes and helps. I'm going to skip the rest of it, right? Multiple nutritionists working with us, fairly easy to consume in the morning. That's sort of what we do. And that's our background. I'm happy to take questions. I'm not sure if the forum has time for the same, but I wanted to make a quick introduction to our style of thinking and what it is that we do when it comes to gut health and what are the areas that we focus on is we try to build one of India's most modern functional approaches to restoration of gut health using real traditional food as opposed to any supplement. Thank you so much.
Thank you so much, sir. It was really a wonderful presentation.
I'm just going to stop the screen share. So there we go.
Participants, you can drop your questions in the chat box. Ma'am, there's a question. Can you explain how COVID-19 influence on gut microbiota?
Can I take up this question?
Yes, ma'am. Yes.
Okay, right. As we discussed about the critical illness, how the critical illness disturb the gut microbiome, the same way COVID-19 also disturbs the gut microbiome. Most of the symptoms in COVID-19 is gastric disturbances. We have many GI disturbances in COVID-19 also. So this alters the gut microbiome and leads to gut dysbiosis and leads to some diarrheal symptoms. It's similar to other critical illness. When we make it a short, it's similar to the other critical illness. It is also a insult, metabolic insult. So that leads to the increases the gut permeability and causes gut dysbiosis, as in the case of other respiratory disorders. Hope I have.
Ma'am, this next question. What is the relationship between gut microbiota and peptic ulcer?
Altered gut microbiome, see, peptic ulcer is mainly caused by the increased number of Helicobacter pylori. Okay. When there is a gut dysbiosis, there is increased number of E. coli and other pathogens in the gut, which leads to gut dysbiosis, and there is altered thing. And there are studies which shows that when there is decrease in when we treat the patient with the probiotics and the prebiotic, there is a decrease in the number of Helicobacter pylori. This increase in Helicobacter pylori will also cause peptic ulcer, and there is a chances of getting gastric cancer. That's how it is related to peptic ulcer.
Sir, there's a question. You said fermented drinks are good for detoxification. Can you give us a few examples for natural fermented drinks?
Yeah, absolutely. I think one of the most noteworthy ones is called kanji. Yet, as you go from state to state in India, you notice that everybody has a different technique of preparing the same drink. Something as simple as taking rice water at night, letting it ferment and having it in the morning. Kanji is typically made from a carrot-based background. So you juice a carrot, you leave it overnight, you mix it with certain herbs, and you'll see a fermented version. Something I personally appreciate a lot is sauerkraut juice. So you take cabbage, you create an anaerobic environment around it, right? So you add some salt, maybe 2%, 3% salt. You press down, let the water of the cabbage completely submerge it. So the cabbage is under water pressure and it's completely anaerobic, well, almost anaerobic. There is still some dissolved oxygen. You wait for about 3 to 4 days. You'll see a lot of bubbling and the entire pH of that product will have come down to 3. It becomes very sour, very acidic. Now, when you look at sauerkraut juice underneath a high spectrometer, in fact, a spectrophotometer or under a microscope, you'll notice that it is rich in 2 types of bacteria, right? One is called Leuconostoc and the other one is L. plantarum. Both are wonderful when it comes to gut health. But again, like I said, expecting that a certain type of product will, or a certain juice will be the saving grace is not the right way to go. It should just be one aspect of your diet through and through. I hope that answers the question.
Ma'am,
How much
this question.
takes to restore?
How much time does it take to regain the lost gut microbes?
Actually, it takes hardly 2 weeks to 3 weeks to restore the gut microbe. Once it is, sometimes it may take longer time also, but within if you're following a proper diet and metabolism, if you want to restore, including high fiber and all, so hardly 2 to 3 weeks it takes to restore. A month maximum.
Ma'am, I have one question.
Yeah.
Is it audible, ma'am?
Yeah.
Yes, ma'am. Ma'am, because of this pandemic, in our home, we used to have home remedy like Kabasuram and Nilavembu Kudinir, all the things we are taking, no, ma'am. So, is there any problem it will cause on gut microbiota?
Sorry, I don't have any idea, but anything in a moderate consumption will not have a problem. But nowadays, when we talk about these sort of herbal remedies, actually, really it works. I didn't say it's not working, but it really works very well. But the quantity, frequency, and the quantity, how much you are taking makes a lot of difference. And people land up in many other gastrointestinal disturbances, gastric irritations, when they consume it in a large amount in a regular basis. There is a time slot, how long you can take and how much you can take. If you're following that, maybe there won't be much disturbance.
Okay, thank you.
Ma'am, the next question is, what is the difference between probiotic curd and normal curd, and why is it creating much of buzz these days?
Much of gut? Actually, probiotic curd, they have a particular culture. Okay, and when we prepare curd at home, it has got many species of bacteria, and it's not restricted to a particular bacterial species. In order to provide a supplementation, we concentrate on a particular bacterial species. That's what they do in probiotics. But when it is in a normal curd, that contains more number of species compared to the thing. So sometimes we feel that a normal curd is better than that probiotic, because we don't know which particular species is helpful in restoring that microbe.
Can we prefer ready-made probiotic drinks available in the market?
I'm not sure about it, and because many studies didn't prove that usage of these probiotics is helpful on a regular basis. Studies, we need more studies on this.
Thank you, ma'am, for answering all our questions.
Thank you very much. Thank you for the opportunity. Wonderful.
Thank you, ma'am. May I now request Ms. Anita Elasi, second MSc Clinical Nutrition, to deliver the vote of thanks.
Good afternoon to one and all present here. I deem it a great honor and privilege to get the opportunity to thank all the dignitaries on the behalf of the Department of Clinical Nutrition, CHS. Let me first start off by giving glory to the Almighty for making today's occasion a resound success. I would like to express my gratitude to all the delegates of the webinar for their presence and contributions. I extend my gratitude to our Honorable Chief Guest, Ms. Uma Shankari Ma'am, to take out our time to grace this occasion. Thank you for enlightening us with your knowledge, ma'am. I also like to thank Mr. Harsh Doshi, sir,
founder Hug Beverages, for your valuable time and your information. Thank you, sir. A special mention to Madam Principal for providing immense support to make this webinar successful. I extend my gratitude to Madam Marina for her presence. I would also like to thank the IAPN organization and the crew members for their contributions. I must thank the teaching and non-teaching staffs and the volunteers for organizing such an event. Last but not least, I thank all the students of CHS for making the event successful through your participation. Thank you, one and all.
That concludes a remarkable, memorable, and knowledgeable session. Though through virtual mode, on behalf of Department of Clinical Nutrition, Trippuram College of Health Sciences, I would like to thank our speaker, Ms. D. Uma Shankari ma'am, dietitian, JIPMAT Puducherry, and also Mr. Harsh Doshi for spending your valuable time with us. Thank you, ma'am and sir, and also our students for actively taking part in this webinar. Thank you, one and all. I kindly request you all to rise for the national anthem.
Okay, thank you, ma'am.
Thank you all for joining. It was really